Good morning to everybody. My name is Bristi and I work as a clinical psychologist at PSRI New Delhi. I would speak on a comparative study which I have done on HIV and cancer patients in the parameters of anxiety and depression. In the recent past, a lot of studies have done and focused on HIV and mental health, cancer and mental health. And if we look at it, when we see a person or a person receives a serostatus, which is an HIV status, or a cancer diagnosis, there's a lot of uncertainty, a lot of mixed emotions are stirred. So there is guilt, there is anguish, and a lot of times denial. So which also gives rise to secondary depression and anxiety, which I have given here in the diagram. Similarly is the case with cancer. So I've just quoted a study each so that I don't crowd the entire slide with it. I have made an attempt here to study whether HIV and cancer patients differ in psychological profiles on dimensions of anxiety, depression, and self-concept with respect to the psychosocial spectrum. Now, the aim, as I have said, is to study the three parameters of anxiety, depression, and I've also added self-concept formation in HIV and cancer, and it's a comparative study. Now, research study is exploratory. It compares the three groups. The non-clinical group is a control group. Sample is small, 60 with 20 in each group, and it's a purposive sampling. Informed consent was taken for all participants. Inclusion was, I've already spoken about the rest. 18 to 74 is the age group, and only advanced cancer patients were taken. For control group, only patients who were not on daily medication, who did not have any psychiatric diagnosis was taken. Exclusion criteria is this. Like I said, only advanced cancer patients were taken. Now, tools I have used profile sheet, Beck's depression, state and trait anxiety, and Tennessee's self-concept. Data collection, it was I interviewed all of them separately on 3 different occasions so as they do not have a carryover effect of one questionnaire to the other. Analysis was done on SPSS. Now results. The profiling, as I saw in the small sample that I had, was HIV was higher in the younger group and cancer was seen to be higher in 56 to 74 age group. Now occupation, in terms of occupation, though there was not a lot of difference in cancer, they came from different walks of life. But the interesting observation which I note was that HIV was higher in traveling related jobs, probably because they have a lot of access to the promiscuous areas leading to the transmission of the disease. Male-female ratio was 7:3 in HIV and 6:4 in cancer. Levels of depression, as we see, is highest in HIV with a mean of 32.35, followed by cancer. If we see the severity of depression in the graph, you can see that depression severity is the highest in HIV, with 55% of severe depression and 45% of moderate depression. Cancer again has three different, there was the first category is no acute distress. Cancer patients, which is the red one, is marked with the red one shows that 20% has moderate depression and again 20% is severe. Though the non-clinical population, there was no psychiatric patients, I have also got somebody which constitutes the last 5% of severe depression who had suicidal ideations and who had excessive guilt, so which also constitutes the 5% in the severe depression category. Total level of anxiety in terms of STAT is again highest in HIV as compared to cancer, which is again closely followed by cancer. Anxiety is highly significant in HIV patients, which is 65% of the blue bar that you see here. Cancer again in the middle, mostly I would say it's the moderate category because as I've already mentioned, I have taken only advanced cancer stage. So probably by the time they get into the advanced phase, they know what are the complications which are involved. They know the apprehensions which are realistic in nature. They know they have already dealt with the disease. So the apprehensions are a lot realistic. So anxiety by then probably is a lesser. So coming to state anxiety again, if you look at it, there is no above average category. State anxiety, as I've written here, is symptomatic or conscious anxiety, which is not there in cancer population, which is the 100% bar that I've shown here. It is more in HIV. I'll probably rush through the slides now. Trait anxiety is unrealistic anxiety, which is again high in HIV. This is the comparative. 5 dimensions of anxiety, apart from self-control and suspiciousness, it was highly significant in terms of ANOVA analysis in the 3 groups. Self-concept was severely impaired. And these are the dimensions of self-concept, 11 dimensions. Apart from variability, rest were impaired. I'll come to conclusions. There was marked depression and anxiety, which was manifested in both the study samples. Severity of depression was higher in HIV as compared to cancer. anxiety present in cancer sample was not significantly high, probably, which I also already said that it's because I've included chronic cancer patients here. Conversely, intrinsic anxiety was in the form of apprehensions were found to be higher in HIV. Symptomatic anxiety was very low in HIV, which I feel was because of denial. They deal with a lot of emotions at that time. Self-concept was severely impaired in HIV because of stigma, self-criticism, self-blame. This is something which I have noted, that depressive anxiety symptom was established as central characteristics. These are the symptoms which manifest in depressive anxiety. Implications, I would say that the study, though small, I'll just cut through, sir. The study, though small, could be used in psychosocial interventions, while we focus more on anxiety and guilt proneness, which is very high in HIV, while focusing more on cancer. This probably could be used in study implications, and this is the limitation of my study. Here I come to an end. There is a lot of room for further research. Thank you, sir.
Thank you very much.